Hello, I'm Raji Anand, Administration Manager at the Institute for Population Health, or IPH, at Weill Cornell Medicine-Qatar. The IPH research team recently published an article on perinatal mental illness in the Middle East and North Africa region in the International Journal of Environmental Research and Public Health. In this podcast, we are in conversation with the authors. I would like to welcome Dr. Satyanarayanan Doraiswamy, Assistant Director, IPH, Ms. Anupama Jitesh, Projects Coordinator, Dr. Sonia Shaban, Projects Specialist, Dr. Amit Abraham, Instructor in Population Health Sciences and Project Specialists, Dr. Karima Shabna, Population Health and Communication Specialist and Instructor in Population Health Sciences, and Dr. Sohaila Chima, Assistant Dean for IPH and Assistant Professor of Population Health Sciences. Dr. Chima, you're the senior author on this paper. Let me begin with asking you, what exactly is perinatal mental illness?
Raji, thank you very much for that question. So just to give a little overview, perinatal mental illness, it basically just refers to mental illness in women during the perinatal period. This is the period from the beginning of pregnancy until 1 year postpartum or 1 year post-delivery.
So as an extension of the first question, Dr. Chima, why did you feel this research topic was important and relevant for the MENA region?
Thank you, Raji, for that question, which is a very important question to answer. So as we all know, pregnancy and the period post-delivery is a very special and unique time in a woman's life. But we also know that this can be a challenging and stressful time. So we would ideally like that this time should be memorable for the woman. However, systematic reviews that have been conducted in high-income countries estimate that 10% of pregnant women and 13% of those in the postpartum or the post-delivery period are likely to experience some form of mental illness. And then the commonest being among those is anxiety and depression. Also, in the low and middle income countries, the figures are estimated to be 1.5 times more than what is reported for the high income countries. We also know that mental illness in a woman during the perinatal period can have a significant impact on the mother and infant's health and well-being. Specifically, perinatal depression is associated with higher rates of infant and childhood illnesses. It is shown to be associated with higher rates of infant, child malnutrition and stunting. There's poor adherence to immunization schedules, increased susceptibility to infectious diseases like diarrhea. We also see poorer physical and mental health outcomes in the offspring of women with perinatal mental illness. And this includes poor cognitive, emotional, behavioral, and social development of the children. Hence, the importance of this topic cannot really be overstated. Given the diversity of the countries in the MENA region, currently, there is no accurate picture of the magnitude of the problem in the region. So we basically wanted to try and explore this further.
Thank you, Dr. Chima. Dr. Doraiswamy, you're the lead author on this paper. Could you please outline the aims and the objectives of the study?
Sure, Raji. As part of the aims and objectives, so we wanted to synthesize and critically analyze the information from published systematic reviews on perinatal mental illness for the Middle East and North Africa region. So the 20 Middle East and North Africa countries included in our study are Algeria, Bahrain, Djibouti, Egypt, Iraq, Jordan, Kuwait, Lebanon, Libya, Morocco, Oman, Pakistan, Palestine, Qatar, Saudi Arabia, Sudan, Syria, Tunisia, the United Arab Emirates, and Yemen. So our focus was primarily to look at the prevalence and risk factors associated with perinatal mental illness in the region. We also aimed to summarize if there were any variations in how perinatal mental illness was measured and to identify research gaps which need to be addressed in the future. We also wanted to provide recommendations that will enhance the mental health of perinatal women in the region.
Thank you, Dr. Doraiswamy. Dr. Abraham, could you please tell us how this study was conducted?
Thank you, Raji. So we wanted to be as comprehensive as possible. So we searched 3 databases, namely PubMed, Embase, and PsycInfo. Since we were conducting a systematic overview, we searched for reviews, systematic reviews, and meta-analyses concerning perinatal mental illness published in the period between January of 2008 and July of 2019. We also conducted a series of supplementary searches, which comprise the reference lists of identified publications for additional relevant reviews, primary studies of relevance between August and October of 2019, and Google Scholar for any relevant studies. After applying our inclusion and exclusion criteria, 15 systematic reviews and 79 primary studies were included in our overview.
Thank you, Dr. Abraham. Dr. Doraiswamy, if I can come back to you, could you please summarize the main results of the paper for us?
Yeah, sure, Raji. As said earlier, the focus of our study was primarily to synthesize available data on the prevalence and risk factors associated with perinatal mental illness in the region. So our overview indicates that perinatal mental illness is a major public health issue in the region. However, there is limited prevalence data determined using standardized diagnostic tools and those that are administered by psychologists and psychiatrists to be able to reliably assess the country-level prevalence. Mostly screening tools were used to identify high-risk individuals. However, we cannot confirm the diagnosis of perinatal mental illness in these cases. Also, the tools utilized to screen for mental illness among perinatal women vary tremendously, or if the studies did use the same screening tool, different cutoff points were applied. Hence, the data we have is highly dissimilar, so very difficult to really compare. We see that researchers in the region have measured various types of mental illnesses at different times during the 9-month pregnancy period and the post-delivery period. Coming to the risk factors part of the study, the risk factors associated with perinatal mental illness are reported to be lack of social support, those primarily from lack of support from the spouse and the in-laws, lack of peer support, lower educational levels, pre-existing physical and mental health issues, negative experiences in previous pregnancies, or complications in current pregnancy, and also a lack of financial stability were some of the risk factors that we identified through our study. Thank you.
Thank you, Dr. Doraiswamy. Dr. Shavna, if I could bring you in at this point, are there any specific findings for Qatar? Is Qatar any different from the other countries in the GCC region or even globally?
Thank you, Raji, for the question. We were able to identify only one study from 2012, which reported the prevalence of perinatal mental illness in Qatar. However, since they used a screening tool to detect perinatal mental illness, it is difficult to say what the exact prevalence of perinatal mental illness is in the country. What we do know is that the mental health and well-being framework in the Qatar National Health Strategy 2030 places much emphasis on improving perinatal mental health in the country. We are aware of the excellent services available at Women's Hospital, Sidra Medicine, and Primary Healthcare Corporation for perinatal mental health.
Thank you, Dr. Shabna. Ms. Jitesh, if I may address this question to you, did the study identify any research gaps pertaining to perinatal mental illness for the region?
Thank you, Raji. Yes, we did find a few research gaps indeed in the overview. Firstly, if I may say, we found that the data on perinatal mental illness was available only for the 13 out of the 20 countries in the MENA region. And even among them, the prevalence data which was generated using the diagnostics tools, which were administered by the psychologist and the psychiatrist to get a true sense of the prevalence, was available only for the 3 countries. And the systematic reviews with meta-analysis, which we included in our overview, have not questioned the use of screening tools for determining the prevalence, and also have not taken into consideration the sensitivity and specificity of the respective screening tools in an attempt to better estimate the true prevalence. And secondly, the systematic reviews conducted in the region on this subject have been of varying quality. So the recommended rigorous methodology outlined for systematic reviews must be adhered to for high quality results. And thirdly, we found that studies which reported on the risk factors for perinatal mental illness have not been designed to study the risk factors in a standardized manner. So a standardized framework to group or to clearly define these risk factors in these studies is still lacking. So most of the studies which reported risk factors were lack of spousal and in-law support, lower education levels, and also lack of financial stability. However, we found that limited studies in the region have attempted to look for association between perinatal mental illness and other factors such as lifestyle, occupation, and environmental exposure, which we know can also contribute to perinatal mental illness.
Thank you, Ms. Jitesh. Dr. Doraiswamy, coming back to you, are there any specific recommendations which the authors are proposing pertaining to perinatal mental health for the region?
We do make several recommendations. But firstly, the data that we have is sufficient to suggest that perinatal mental illness is a major concern in the region. Recently, we've seen more women in the MENA region complete their higher education and enter the labor market. However, they are still expected to maintain their central role in maintaining and managing the family. Under these circumstances, family support becomes extremely critical for women to be able to maintain optimal mental health. Education and wealth are likely to be factors which prevent the women from falling into a vicious cycle of stress during pregnancy and after giving birth. So social influence, particularly spousal support, is seen as a key aspect in improving perinatal mental health in the region. Programs and policies in raising awareness of husbands and in-laws through mass media, community gatherings, as well as during antepartum and postpartum consultations can be very useful interventions. Given the data gaps, there appears to be low awareness and a high level of stigma associated with perinatal mental illness among all stakeholders. So programs must be implemented which are tailored to the specific socio-cultural context of the country. There is a need for additional research in the region exploring risk factors for perinatal mental health related to lifestyle, occupation, and environmental exposures. We do believe that there is a great scope for a regional approach to estimating perinatal mental illness using standardized methodologies as part of a well-designed, scientifically rigorous research which can help address this important public health issue. Lastly, the research capacity on perinatal mental illness should be strengthened by regional institutions such as the World Health Organization in partnership with leading academic institutions in the region.
Thank you so much, Dr. Doraiswamy. Dr. Shaban, if I may bring you in at this point, what are the limitations of the study?
Thank you, Raji, for this question. Indeed, this overview has some limitations. First, the data from primary studies were extracted from the systematic reviews, and quality was assessed based on their findings as reported in the systematic reviews. Secondly, extreme variations in the perinatal mental illness definitions, methods of assessment, and study quality precluded us from performing a meta-analysis to arrive at a pooled prevalence. The third limitation is that the primary studies were reviewed only if outliers or errors were suspected. Fourth, the studies included in our analysis represent only 13 out of the 20 MENA countries, and the majority of these studies are from Pakistan. Hence, it may be difficult to generalize the findings to the region. We were also not able to gather any data for the relatively low-income countries of the region. And finally, though we scanned extensively for both published and unpublished literature, all retrieved studies were in English. Hence, we may have missed data published in other regional languages.
Thank you, Dr. Shaban. Dr. Chima, if I may invite you to make some concluding remarks.
Thank you, Raji. Happy to provide some concluding remarks. As we've all discussed, our systematic overview identifies that perinatal illness is an important public health issue in the region. Standardizing approaches for estimating, preventing, screening, and treating perinatal mental illness would definitely be a step in the right direction for the region. Countries which have no available data should identify this as a major gap, and this must be addressed at the national level. Countries in the region must prioritize mental health during pregnancy and the postpartum period, increase awareness, and address any stigma which is associated with it. We also know that Qatar, for example, as part of the implementation of the National Health Strategy 2018-2022, at the Ministry of Public Health, they've set out a plan to promote mental health and well-being, improve access to mental health services for all residents. The plan aims to improve access to integrated mental health services within primary and community settings, which are free from stigma, which is often associated with psychiatric facilities, with the aim of really enabling people to access these services in the mainstream health facilities. This is a great commitment from Qatar, which can be emulated by other countries in the region and even worldwide. So we, as the Institute for Population Health, are at the forefront of lending full support to the state of Qatar and its overall goal of promoting mental health and well-being in the country. Thank you.
Thank you, Dr. Chima, and also to all the authors for an enlightening conversation on the significance of perinatal mental illness in the MENA region. Listeners and viewers, if you have any comments or suggestions, please do write to us at iph@qatar-med.cornell.edu. Stay tuned for our next episode and connect with us on social media, #IPH Qatar. IPH, paving the way to population health.